Dr. Olivia, thank you so much for joining us today. So, this is a special edition from the Mama Brew crew where we're brewing up real talk around motherhood, about health, and maybe everything in between. Today, we are especially excited because we're joined by Dr. Olivia Woods, a UK-based GP who's not only deeply experienced in women's health, but also happens to be pregnant herself. So she's living it, not just preaching it. So we're going to be chatting about different topics, about most of the maybe the common questions that Dr. Woods gets, but also maybe some of the common questions that we've gotten in Mama Brew around vitamins, around caffeine consumption, and about the science and medical guidelines around that. So whether you're expecting, nursing, or just trying to figure it all out, this one is for you. So, Dr. Woods, could you tell us a little bit about yourself and what do you do as a GP?
Well, so I am a GP in Somerset, in a sort of quite a small little town called Bridgewater. Um, I love the job. I've been doing it for 3 years now. Every day is completely different. I get to work with people across all stages of life, which I think keeps things really interesting and quite rewarding as well. So literally from cradle to grave, which is really great. My husband's a GP as well, so we're quite a medical household. So yeah.
Very good. And um, I think offline you were sharing that you're pregnant as well, and has pregnancy influenced or shifted a little bit your perspective, maybe both personally and professionally?
Um, I think so. Well, yeah, I know so quite a lot. So it's changed how I see things in quite a big way. I guess I've always enjoyed caring for my pregnant patients, but now sort of understanding what it really feels like is just a whole different ball game. So, sort of the tiredness and the emotions that come with it, and sort of having to juggle both day to day life plus working in medicine. I definitely feel a lot more empathetic to my patients, and so I'm sort of aware of, I guess, what people are carrying behind the scenes. I guess on a personal level, I've just had to adjust quite a lot of different things. So, how I train at the gym, for example, how I rest, how I have to actually add rest days into my day. I think, yeah, that's pretty much it. I'm learning to listen to my body a little bit more, and I think as a doctor, we don't often do that, and I think we get told off quite a lot for doing that.
Yeah, my wife and I, we've had our first baby 8 months ago now.
Oh
Tomorrow,
wow!
our baby
Oh wow!
Sophia is going to be 8 months, and we found ourselves doing all types of research as new parents, but very ignorant in the space. Let's say we lacked a lot of knowledge, and we were trying to not only follow the resources or um, information available to us through the, let's say, the health system, but
Mm.
obviously trying to investigate on our own, see what other people that had gone through that experience recently had to say. It can get a little bit, at least for our own personal experience, a little bit overwhelming, right? Because
Mm.
there's so much conflicting information. Some say you do this, you shouldn't do that, and so on. So is there something that you wish more people knew about this particular and so important stage of life of when you're pregnant?
Um, I mean, it's a tricky question. I think it's so in my population as a GP, we've got quite a young population, so a lot of younger mothers, and I think social media's had such a big influence on them, and I think a lot of people, at least in my experience, seem to think that pregnancy is a lot about sort of the cute bumps and glowing skin and how amazing pregnancy is, which it is. But I think people need to know that it's actually way more complex than that. So although it's joyful, exciting, it's so tiring, it's emotional, it can be really overwhelming, and how normal that is. I think it's really important for people to know how important support is at that time as well. So, whether it's your partner or people at work making adjustments for you, or friends, just having someone out there sort of to check in and say, what, you're actually doing okay. And if you're not, then that's fine as well. I think keeping hold of some things that make you feel like you are really important. So whether that's exercise or doing some things that you used to do before you were pregnant, being outdoors, or something like a quiet coffee or something like that, it just makes such a big impact, I think.
Yeah. I it, it- speaking of coffee, so and you touched on support. This whole idea about Mama Brew started out of empathy. Literally, just one morning, I'm making coffee in the kitchen, the whole ritual, grinding the beans. My wife is 2 months pregnant, and she's taking her vitamins, her supplements, and she's looking at me and she's telling me, "Oh, I really miss your coffee." Because I do the whole thing. That really, we're really coffee aficionados here in the house. And but as you know, when you're pregnant, you gotta reduce your caffeine intake. You gotta be very vigilant and so on. So her understanding was that she couldn't have any. Right?
Mm.
So because I wanted to feel to support her in that sort of delicate moment of her life where she was like, "Oh, I love coffee, but I can't have it." That's when we started to investigate a little bit about what the possibilities or the options out there were, and we didn't find much, right? So when women ask you about caffeine during pregnancy, what are the usual concerns that they usually raise to you?
So it's interesting what you're saying about your wife. So I think that's probably the most common thing I get, and I hear people saying, "Do I need to give caffeine up completely?" And I think there's so much misinformation online, and like you say, there's sometimes it's just really difficult to find any information whatsoever. So I think a lot of women feel really guilty or nervous about having coffee or caffeine in general very early on in pregnancy, and throughout the rest of pregnancy as well. But I think a lot of people feel very guilty if they've found out they're pregnant a little bit later and they say, "Oh no, I've been drinking coffee," and I think
Yeah.
it can be very confusing and overwhelming as a result.
And are there any specific guidelines, any guidance that you share with your patients, or what are them? Yeah, like what are the clinical recommendations from a caffeine intake perspective?
Yeah, so I always use the NHS guidelines. I always quote them. So ideally, we want to be sticking under about 200 milligrams of coffee per day during pregnancy. There's a very good caffeine calculator on the Tommy's website. It's very easy to use, and you can just pop in how many teas, coffees you normally would have a day. Also thinking about things like, I guess, energy drinks and even chocolate has caffeine in it. So I definitely would recommend a lot of my patients to go and have a little look at that and assess how much caffeine they're having day to day. But roughly 200 milligrams is about one strong coffee or like a couple of cups of tea a day. I think when you're breastfeeding, you get slightly more leeway, but you should still keep an eye on it and not go overboard.
Okay, and in terms of why that's important be to have those caffeine limits in your radar as you're pregnant, why is that important? Why are those limits in place?
So it's mainly about the risk, reducing the risk of things like miscarriages or having a low birth weight. I mean, the evidence, again, with anything, because we can't do a lot of studies on pregnant people, so the evidence isn't crystal clear, but the sort of the 200 milligram limit is a very cautious guideline, and so it should sort of, you should be able to incorporate caffeine into your day-to-day life in a balanced way. But obviously, yeah, going too far over that will put you at greater risk of things like miscarriage and a low birth weight.
Sure. And are you how are you personally approaching your caffeine intake now that you're pregnant?
So myself and my husband are probably a little bit like you and your wife. We really really like our coffee, and we like the whole ritual of it. We love finding different coffee beans and grinding the coffee and everything that goes with it. So I think we still very much make time for our morning coffee together. I'm more mindful then during the rest of the day. So I say, well, actually, I need to have a look at my chocolate intake because I love chocolate as well, but I feel like coffee is probably more important to me at the moment. And yeah, I just for me that ritual just grounds me, and I think has really kept me sane during pregnancy so far. So that's how I approach it. I say everything in moderation, and I do try and monitor, and I don't want to go over that limit that I've that I set for myself, and there's the NHS guideline.
Yeah, yeah. My it was particularly tough for my wife as well because she also loves chocolate, and we don't usually associate chocolate with caffeine so quickly. But it turns out obviously there's different varieties and different levels of caffeine in chocolate, and when as you rightly pointed out, when it adds up, right? You can have maybe some kind of Coke, and then you have some tea, and then you have one chocolate, and then you have your cup of coffee. You're
Exactly.
already exceeding the NHS recommendation, right? So, in terms of if we shift a little bit towards if we shift the conversation a little bit towards the role of supplementation. Obviously,
Mhm.
when women are pregnant, their nutritional needs also change and shift quite significantly. Have you found that yourself as well? Obviously, sorry, and I was meant to ask you earlier, is this your first baby?
This is my first
Are you a
baby.
first time mom? Okay,
Yes.
so have you found yourself that this, like your nutritional needs have shifted quite dramatically during your pregnancy?
I think they have. I mean, it can be difficult to know, I guess, in yourself. I definitely feel much more hungry than I did. I'm craving different foods, and that's the body's way of crying out and saying, I need different vitamins and nutrients. Which is so important, because I think sometimes again you forget that you're literally creating a whole new human. And if you're also staying active and busy at work, you obviously need support in lots of different ways in terms of vitamins and nutrients and things like that. So obviously there's quite a long list of vitamins that are recommended. I think a lot of my patients, they are very aware that folic acid is very, very important, especially in the first 12 weeks of pregnancy. But we often then don't think about the other things like vitamin D, things like iron itself, iodine, omega-3. So all of those things are really important, and will often be part of, I guess, the supplementation that we would normally advise pregnant ladies to start taking.
Hmm. Throughout pregnancy, is there like a top three of those vitamins that you're like, hey, this is non-negotiable. We absolutely need to keep in mind at all times to ensure that obviously for the health of the baby, but for the health of the mom as well.
I'd say top three. So folic acid, definitely one. It's going to be so important for sort of development of the neural tubes, part of the spine of the baby, especially in the first 12 weeks. It's difficult to name two other ones, but I guess iron, especially later on in pregnancy, a lot of women find that they are iron deficient, and that could be a huge cause of tiredness in pregnancy. So I think iron definitely, and vitamin D as well. Vitamin D, again, both for the baby and the mum. For the mum, that can really help with tiredness, and it will help with the sort of development of bones for the baby as well.
Yeah. Are there any differences in the needs of a woman who's pregnant or a woman who's breastfeeding?
Yes. So when you're pregnant, like I said, obviously you're building a whole new human. Your priority at that point is going to be things like the folic acid, like I mentioned, iron, building up nutrient stores to be able to pass that on to the baby. When you're breastfeeding, it's more about looking at milk production rather than sort of growing the baby itself. So although that can be very nutrient demanding as well, I guess the priority would shift to things like iodine, calcium, really, really important for breast milk production, and vitamin D again. So I can't rate vitamin D highly enough.
Okay. Very good. Very good. Music to our ears in the Mama Brew community for sure. Um, Dr. Woods, you've had the opportunity to uh, review Mama Brew and maybe have a look at the different blends that we have. Obviously, this is as we mentioned at the beginning, this was made with in the mind of we had our own personal experience where we didn't see much options out there. Um, and we understood that through our investigation, we needed to do something that would be either low in caffeine or decaf, but also with the added component of the vitamins. Is there something that stood out from a medical perspective when you were reviewing Mama Brew?
Well, first it was delicious. I really, really enjoyed the taste. I had it this morning. I really like the idea. I think if you're going to have a coffee anyway, then and you're pregnant or breastfeeding, why don't you make it do a bit more for you at the same time? So I think when things are busy and overwhelming, and you want that daily ritual, like we mentioned before. Yeah, if it's also packing a punch with all the vitamins and nutrients that you need, then it's such a great option. I can't see anything wrong with it at all. I think as long as it's safe and evidence based, and very transparent with ingredients, which it very much appears that Mama Brew is, I think it's a really great option and a really good idea from a medical perspective.
And as a GP and again as an expecting mom, what would you say to women who are feeling maybe a little bit guilty or confused about having coffee during pregnancy or while nursing?
I think it's reiterating how everything is about balance, and we need to weigh up the importance of doing things that make you feel more human when you're having this absolute whirlwind of a time, um, with the safety side of things. And I think, like I said, we don't need to cut out coffee, caffeine completely. It's just about being mindful about how much you're having, and certainly if you're able to drink something which is giving you both that caffeine hit, the taste of coffee, but also has added vitamins, then what's there not to love?
Got you. And doctor, is there a particular factor or series of factors that you would look for or assess before providing any recommendations or feeling confident in providing any recommendations for products? Let's say like functional coffee, like Mama Brew, or any other stuff that has um, added nutritional value to your patients.
So I think it's really important to have a very clear ingredients list. That's what I'd be looking for in, I guess, any supplement. So if there was a coffee that had added supplements, I'd be also looking to see exactly what's in it, sort of the nutritional information, nice and clear and transparent, and I guess the reassurance that it lines up with the NHS guidelines that we spoke about before. I think obviously it's important to be realistic. That's something that fits into real life. But as long as it's safe and evidence based, and helps people who might be struggling at this time to feel a bit more supported during pregnancy or breastfeeding, I think something I definitely would recommend to patients.
Gotcha. Um, Dr. Woods, is there anything that you wish you were asked more often when you're seeing your patients that you're surprised is not you don't get asked about as often as you would want?
Um, I think people they just don't ask about the bad side of pregnancy as much. Like I really want people to reach out about how they're feeling, how they're really feeling, and not just how they think they're supposed to be feeling. So certainly things like low mood and fatigue, because there are things that we could do to support. There's things that we could do to investigate, and a lot of people just brush it off as being part of pregnancy, when often there are things that can be done and should be done.
Definitely. I think my wife experienced the whole roller coaster of emotions, both from a physical perspective, from maybe a well-being perspective, mental wise, and I think the community aspect, having people that she could relate to and maybe offload some of what she was going through, not only with me as her husband, but having women that were going through the same, maybe. She found it super useful because she could tell me uh, a lot, and
Mm,
I can only imagine what it would feel, but I don't think I had the ability to empathize as much as somebody that's actually living what she was going through. So I think
mm,
that the community aspect played a big role. There's a lot of groups out there that really provide support and really clear, simple to follow guidance and advice, and I think that was super useful for us.
mm.
Um, Doctor, is there anything that we haven't discussed today that you'd like to share as we wrap up this conversation?
I think you've covered all bases, really. No, I don't think so. I think that's it.
Dr. Woods, thank you so much for joining us today. I think your insight is incredibly valuable to us. We truly appreciate you, not only as a GP, but as someone who's in the journey yourself right now. So congratulations for that. It's super exciting stage. It's one of the most marvelous, certainly it has been for us. So it means to us a lot to hear from you, someone who brings both the clinical knowledge and the lived experience. So thank you so much for your time. And to everyone watching or listening, thanks for tuning in. We hope this has helped you. And if you think it might help another parent, please share it. Thank you so much.
Thank you.